What is latent TB infection in pregnancy? Imagine carrying a silent partner in your body that's not causing any trouble but still has the potential to wake up later. That's what latent tuberculosis infection is. It happens when a woman is infected with the bacteria that cause tuberculosis, but the bacteria stay inactive in her body. She feels perfectly healthy, shows no symptoms, and cannot spread the bacteria to others. It's like having a dormant volcano that's not erupting but could do so if conditions change. During pregnancy, this silent infection becomes a bit more important to watch. The immune system naturally changes to protect the developing baby, which can sometimes make it easier for the bacteria to become active. If the bacteria do wake up, it turns into active tuberculosis, which can be serious for both mother and baby. Active TB during pregnancy can lead to complications like miscarriage, preterm birth, low birth weight, or even death around the time of birth. That's why screening for latent TB infection is a key part of prenatal care in many places, especially if the woman has risk factors like recent exposure to TB or HIV infection. Screening usually involves a simple skin test called the tuberculin skin test or a blood test known as the interferon gamma releases assay. These tests help identify if someone has been infected with TB bacteria, even if they don't have symptoms. If the test is positive, healthcare providers will carefully check to make sure there is no active TB disease. This involves a clinical exam and sometimes a chest X-ray, which is usually done with proper shielding to protect the baby. Deciding whether to treat latent TB infection during pregnancy depends on individual risk factors. If a woman has a high chance of developing active TB, such as being HIV positive or recently exposed to TB, treatment might be recommended. The goal is to prevent the bacteria from becoming active later on. Some medications used for latent TB can be safely given during pregnancy, but the decision is made carefully by healthcare providers, weighing the benefits against any potential risks. Throughout pregnancy, women with latent TB infection need close follow-up. This helps catch any signs of the bacteria becoming active early and ensures both mother and baby stay healthy. The key is personalized care, guided by medical experts who consider each woman's unique situation. In summary, latent TB infection in pregnancy is a hidden, inactive form of tuberculosis that requires careful evaluation and management. It's not something to panic over, but it's important to understand that with proper screening, monitoring, and sometimes treatment, the risks can be minimized. Always consult healthcare professionals for personalized advice and care, because every pregnancy is different and medical decisions should be tailored to individual needs.